You're drinking cold water and all of a sudden you feel a cold twinge in your teeth, or you bite down and your tooth starts speaking to you. I'm Dr. Terri Alani, the Texas Tooth Lady, and I'm going to break down what causes tooth sensitivity. You may be brushing too hard. Using a hard bristle toothbrush or brushing too aggressively can wear down tooth enamel. It can also cause gum recession, which exposes the root of the tooth, leading to increased sensitivity. So we recommend a soft bristle brush you can pick up at your local drugstore. These areas are also caused abfractions, and they can also be caused from clenching or grinding. So we recommend a custom fit night guard, not one size fits all, but custom fit made by your dentist. Overuse of tooth whitening products can also cause tooth sensitivity because some of the whitening ingredients added to these products are not meant to be used on a continual basis. Use of Prevident toothpaste prescribed by your dentist will help with increased sensitivity, and remember, whiten in moderation. A broken or cracked filling leaves the tooth vulnerable to bacteria, which can also cause sensitivity. Are you a mouthwash junkie? Just as acidic foods can wear down tooth enamel, so too can acidic mouthwash. The long-term use of an acidic mouthwash is not good for your teeth, especially those containing alcohol or harsh chemicals. They can worsen your existing sensitivity. Eating an acidic or a high-sugar diet can also lead to tooth sensitivity because these can erode your tooth enamel. So no matter what the cause of your tooth sensitivity, the first step in treating it is to see us, your dentist. We'll help you get to the bottom of what's causing it and come up with a solution that works for you. I'm Dr. Terri Alani, the Texas Tooth Lady.